Technology's rules. There we go.
All right.
I'm ready to go.
Hi, good evening, everyone. Thank you guys so much for joining us. We appreciate you taking time out, especially after a holiday, this cold, almost winter night. My name is Emily Keller. I'm the Special Secretary of Opioid Response for the Moore-Miller Administration. It's an honor and a privilege to be here tonight. And we're going to go over a little bit later what my position is, what we're doing, why we're here tonight. First, I would like to turn it over to your health officer, Dr. Brewster. Thank you so much for being here.
Thank you. Thank you so much to you and your team. And we really are very honored to have you here in Harris County. I know it was a far drive on a cold night. But we definitely appreciate you and everything that you're doing up at the state level and that the Moore administration is doing at the state level to tackle some of the issues in our state that continue to really challenge our communities. For all of you here in our community, it's wonderful to see you, and we really appreciate you taking the time to come out on a cold evening and be with us here this evening. We're here to talk about an issue that we have been really tackling for many years, right? That many of us have felt a significant impact on this issue of opioid use, opioid drugs, and kind of everything associated with all of that, right? We've been, I don't know if any of you were there several years ago in this county, we held an event, Hollywood Fire Station, and we just had such an incredible turnout from our community. It was just, it was riveting because we heard so much struggle, we heard so much pain, we heard so much sorrow. Yet we also felt a lot of hope, right? We still feel a lot of hope because we see these amazing stories of recovery. We see the amazing things people can do to not only help themselves and their family members, loved ones, and then to give back to their community and really kind of pay it forward. And so we're in the spirit. We're here in the spirit of that. We're here because we all here in this county still have a lot of hope. And despite the ongoing challenge we have with drug use or with opioid drugs in our community, and making sure that we have the services and supports and recovery supports in our community, that despite all of these challenges, we still have a lot of hope and togetherness. So that's, again, that's really what this evening's about is to recognize that, kind of just pause for a moment and think about everything we've been doing together, collaboratively in this community to help our neighbors and to help ourselves and our family members. And hopefully that as we move forward and we work with the opioid support in the state and with Special Secretary Keller and her team, that we keep pressing forward. We keep finding, okay, what are the ongoing gaps in the community, and how do we build upon them and keep being strong here. So what tonight is somewhat of an informal discussion, right? But we do have some visuals above my head that feel free, I'll chat about a little bit. I just wanted to frame tonight's discussion by talking a little bit about what we're doing here in the county. So we've got some amazing partners in the room, and we've got some our amazing team at the health department. Thank you. Who have been working with our community members to make sure we are getting services in our county, right? And that those services are reaching the people who really will use them, will get their family members connected to those services, and so forth. So let's talk about that. And then I'd love to talk more a little later about what else can we do, what else is needed, and really, your voice is so important as we talk about all that. So really what we've over many years now, we have been working on bringing partners together and our community members together so that we can map out what we need to do in this county to both prevent, and including our young people, but any age, from starting along the path of becoming addicted or using opioid drugs. And then if that happens, making sure that we have the supports to help people through that journey and to help people into recovery if they're ready for it, and to keep supporting our people and their families through that journey. And so this is what we call the opioid crisis response. If you want to take a look at it in more detail, there's a QR code on the screen, scan it in. And this is what the partners in this community have put together, saying, okay, these are all the gaps in our community. And we've used this as a roadmap, right? This tells us, okay, this is what we've agreed upon, our gaps, and this is where we want to head. So now as dollars come in to support us in this county, we can put those dollars towards some of the work that needs to get done. And you can see here, we've listed out, it's like looking at it as a continuum, right? It's not just about having a medication or a treatment. It's about everything. It's about prevention. It's about help along the way. It's about getting people connected to treatment when they're ready for it, if they're ready for it. It's about getting people supported and all the services that they need to support their long-term recovery, because we know it's a lifelong process. And it's about many other things around that. You know, measuring the data so we kind of know, well, what is this county doing? How are we doing at the county level? And making sure that we are getting partners to work together to continue to work on all these issues. So that's our opioid response plan. We have a lot of strategies that have been implemented, especially over the past 6-7 years. I mean, some phenomenal work that we'll talk about. If you go to the next slide there, it shows you an example of one of the new things that we have. It's a data dashboard. And so, it's numbers, right? And we know numbers don't capture everything, but numbers are important because they help us tell a story. And they help us tell a story to people who may fund us to do more of the work we think is important for all of us who live here. And so our opioid data dashboard is a great way for us to see how our county is doing in terms of the impact of opioid drugs, but also in terms of the work that we're implementing, such as getting Narcan into the hands of everyone and helping to save people's lives and helping to connect them to treatment and to recovery support. So a lot of that's data we collect and we update on this dashboard. Next slide, please. Thank you. One of the things we really need to recognize is there's been so much advancement in what we can offer to our community members in this county over many years. And I think one of the amazing highlights of that, right, of that progress that we've made is that building just down Great Mills Road. Has anybody here seen or driven by or walked by the Health Hub? All right, so the Health Hub is amazing, and we're very, very fortunate that Special Secretary Keller came to the Health Hub right before this meeting and took a tour of this facility. The Health Hub is about community partners working together and looking at the whole person within the context of their family, within the context of their community. And because of this Health Hub, it's a donated bank, right? PNC Bank donated that building to this county. And because of that, we have made sure that we're offering crisis services. We have some evaluation services. When people don't know where to go, they don't know where to start, they can walk in, we'll hold their hand, we'll help them out, we'll get them connected to our treatment providers in the community, such as Pyramid Walden and Pathways and some others, who will then continue to surround them with the care that they need. And we offer a variety of other things in that. We have a primary care clinic. We do financial coaching, literacy tutoring. We do mediation services, so when people are in some kind of argument or conflict, we help them resolve that so they can focus on their health, and so they can take care of them. We give them health insurance. There's a lot of things that we do in there, and we do it through so many different partners, all these different community partners in our community care, and who are coming together and want to surround our community members with all this help. And so it's a wonderful space. We want it to grow. If you go to the next slide, thank you. These are some of the services that I mentioned, some of them that we're offering through the Health Hub. We want this to grow. This is the kind of model that works. When you think of a person as a whole person and not just a part, this is what really helps people move forward in their lives. So all this is happening at the Health Hub, and it's happening through so many different partners. We want that to grow. One way we're hoping to grow it, as well as other services in our community, is through the opioid settlement fund. So if you all know that, there was a lot of concern about distribution of medications that really, kind of got this crisis, the opioid drug crisis that we've been facing nationally going. There was concern from the pharmaceutical side. There was concern from the makers of the medication and the distributors of it, the prescribing of it. A lot of concerns from many different players, and how so many opioid drugs flooded our streets, and so and medicines happen. And so what we're looking at now is that some of those companies have been sued and are being held accountable for those past actions. And the way they're being held accountable is by saying you have to contribute dollars to the communities that are now hurting because of that neglect or that poor action. And so these dollars, in some cases, are coming to our community, right? I mean, through some settlements are coming to our community, and as more and more settlements happen, those dollars will come back to our community, so we can start to repair some of the hurt that's been done, and so we can start to build some of the structure that we need to prevent more issues in the future. And so as these dollars come in, we are going to be investing them in things to support treatment, recovery, youth, mental well-being, right? How do we uplift our children and surround them with the type of support they need, and all the prevention messaging that we need to do when it comes about preventing starting drugs in the first place, and so much, right? How do we address mental health? How do we address so many other things that are affecting a person's ability to be healthy as well? And so a lot of these needs that we're going to be addressing dollars to are listed up here. And again, there's a lot of need. We all recognize that. And I think we'll start talking about that in a moment. But we've made some great progress, and keep holding on to that hope, because that hope is what got us further along to a place where we can now be proud that we've done a lot of work together here. I'm going to pass it back to Special Secretary Keller, and I think you'll have a few remarks as well. And thank you.
Thank you so much. I appreciate all the work that you and your team are doing. And my name is Emily Keller. It's an honor and a privilege to serve as Maryland's first Special Secretary of Opioid Response. I found out about this position that Governor Moore created in January of this year, a month and a half after he was elected to be the governor of Maryland. He took a look at the landscape of Maryland, what we were doing at the Operational Command Center, and he felt like there needed to be more of a focus specifically on substance use. So he elevated the position of the executive director to a special secretary position that would report to his cabinet and report directly to the governor on this specific issue. Prior to accepting this role, I was a city council member in the city of Hagerstown from 2016 to 2020, and then became the mayor of the city of Hagerstown in 2020. I joke a lot, but I'm serious. If you would have told me 10 years ago I was going to run for office, I would have told you were out of your mind. That was not in my cards. It was not anything I ever planned to do. But my best friend from childhood actually struggled with a substance use disorder back in 2012, 13, 14, 15. And I got so frustrated sitting in Western Maryland and watching our system fail her over and over again. And, Ashley was treated like a criminal consistently. And she would get violation of probation, she'd get thrown in jail for 90 days, she'd get out. Violation of probation, get thrown in jail for 90 days, she'd get out. And I watched this vicious cycle and I'm going, she's not hurting anyone but herself. She needs treatment. And every time she would come and say, you know what, I'm ready. There was never that. It was always like pulling teeth. And I sat and I thought, when I'm sitting on the sidelines and I'm kicking and screaming, I'm yelling and I'm complaining, someone said, why don't you run for office? And I was like, no way, like not a chance. And the more I started thinking about it, the more I'm like, all right, maybe if I run for office because I'm loud and I'm going to be obnoxious and I don't back down from a fight. And I thought maybe this is how I can make change. So she was actually in Harford County Jail serving violation of probation in January of 2016. And she called me and I said, I think I'm going to run for office. And she laughed at me. And she was like, have you met yourself? You don't have a filter. You're covered in tattoos. You're not a politician. Like what? And I was like, well, maybe that's what we need. Right. So I went out, decided I was going to run for office. And this is all I talked about. It's all I talked about. I'd be in debates and they'd be like, what are you going to do about the tax rate? I'm like, I have no idea. But we're not going to have people to pay taxes if we don't start treating the substance use crisis that we're experiencing, especially here. So thankfully it resonated in April of 16. I won the primary, super excited, got to go on to the general election. And unfortunately, 2.5 months later on June 27th, Ashley lost her life to an overdose. So to me, what was and still is the worst day of my life, once I was able to swallow it and grieve, I thought there's got to be a reason. There's got to be a reason why I'm here right now, and I can't let this heartache and this grief stop. So I just kept going, and I said, you know what? I made her promise that I would be loud and I would be bold, and so that's what I did. And thankfully, the community heard me. After I got elected, I started Launch Washington Goes Purple, which is just like you guys Goes Purple, an education movement for our youth and community about the dangers of substance use. I joined every board imaginable that had anything to do with substance use. I know Vicki Sterling, who's the director of behavioral health in Washington County, is now one of my best friends. But I think for the first year I was in office, she was like, this woman shows up in my office all the time because I was just relentless. Like, we need to do more, we need to do more. So when I had the opportunity to run for mayor in 2020, I took it because I thought if I can be closer to Annapolis, I can be louder. And somehow, thankfully, I ended up here, and I thank Governor Moore because the entire time he was campaigning, I was like, you need to put a focus on this. Because Maryland has done a lot of things right, and we have made incredible strides over the last several years, but we need to do more. So I'm thankful I get to oversee the Opioid Operational Command Center. We are the state's coordinating office for the overdose response. So we don't just focus on the health piece, we don't just focus on this piece. We work with all 24 jurisdictions and all the state agencies to say, okay, Department of Labor, what are you doing to help support recovery-ready workforce? And Hay Housing, what are you doing to support recovery housing? We're going to work with all of that to come up with a state strategic plan to combat this overdose issue, which is why we're here. I said, if we're going to work with all 24 jurisdictions, then we have to go to all 24 jurisdictions. And this is number 19 out of 24. It's been really awesome to get to see the state everywhere and to get to hear from everyone. And that's really what we want to do, is we want to hear what's working here, what's not, what you need from the state, what we can do better at. And then as we formulate the next state strategic plan, we will take all of that into consideration and say, all right, we've heard loud and clear that we need more transportation services. But how do we allocate dollars to help solve the transportation crisis? Things like that. So before I turn it over to you guys, which is the real reason we're here tonight, to hear from you, I just want to go over very, very, very high level the 5 things that we're focused on right now as an administration, which may change in just some bullet points under each. So the first, of course, is prevention. We want to focus on addressing trauma and adverse childhood experiences and promoting school-based and after-school youth programs. Our second focus, which we're very excited about, is a new focus, and that's harm reduction. We know we need to meet people where they're at. So we want to make sure that everyone in Maryland has access to naloxone. If you don't carry naloxone, they have some here, please get trained and carry it with you. It's our #1 life-saving tool. We want to make sure that we're focusing on expanding syringe service programs, granting wound care programs, and making sure that people have the tools necessary and the peer support specialists necessary to meet them where they're at. We also wanted to expand on our drug checking initiative. We have RAD here in Maryland, Rapid Analysis of Drugs, which just allows us to know what's in our list of drug supply, where, and in real time. Anonymous, but that allows our harm reduction folks to be able to tailor their efforts to make sure that we're keeping people safe. Our next focus area is treatment. Pretty self-explanatory, but when someone says they're ready, and we need to make sure we have the tools necessary to give them what they need. We also want to make sure that that's equitable access to care, so whether that has to be through transportation services and telemedicine, we want to make sure pharmacies have medications for opioid use disorder and that we're increasing access to that. We're promoting care coordination across the continuum. Our fourth focus is recovery. We want Maryland to be a recovery-friendly place because we know recovery isn't a 28-day process. We won't just go for 28 days and say, okay, we're done. We have to make sure you have the tools necessary to thrive. So we want to promote employment and recovery-ready workplaces, and increase compensation for peer support specialists because we have some of the best peers here in Maryland and we need to make sure we're keeping them here. And our last focus is public safety. So we're getting away from an enforcement aspect, an interdiction aspect, and public safety as in how do we divert from the criminal justice side into a treatment side. So promoting things like law enforcement and assisted diversion, making sure we have medications for opioid use disorder in jails, and hopefully we can expand that into prison, and then having better care coordination on release. So we'd be here all night if I went into detail of all those 5 things, but that's just very high level what we're looking at as we prepare the next state plan. So we only have 3 people signed up to speak tonight, but we're just going to open it up after that. I'll call on them first. But if you're here and you'd like to talk again, what's working, what's not, what you need from us, please do. I always say try to keep your comments limited to 2 minutes, but we've got some time, not going to buzz you out or anything. But the first person we had signed up to speak was Trina Benson.
Unfortunately, she's a colleague of ours and she had to cover some support groups, great recovery groups.
Amy Young.
Also not
Okay.
We have her comments, but we thought that we would send them, we'll have her forward those to your office. Because she did send it to us, but we thought that it would be best for her to have her voice, but she had found, written that she had to.
No problem. The last one is Zerial Savoy.
Oh, okay. Easy. Everybody here.
Oh.
Oh, live stream. Okay, all right. Okay, all right. Good evening, thank you to all the community members and also the resources that are here. First, what I wanted to bring up as far as the treatment aspect of those that you pointed out. Our adolescents, juvenile, don't have a place for treatment, especially here in the Southern Maryland Tri-County region. That goes back to the education portion and everything that gets hindered if they've already hit it. Also, the ability for the peer support specialists, the peer recovery specialists, to be able to speak to the people, even within the school system. So if we're going to educate them, then we need to be able to talk to them because we live it. And it's not going to be so much of this is your brain, this is your brain on drugs, right? Gone are those things, and so are the threats of what they can do. Being able to hear it from those of us that have been there, I believe would help as far as that. Lastly, we have a new substance that has been found here in Lexington Park. Aniline, ANILINE, which came from RAD, as a result of that we got back. And it's a very toxic substance that's being added to the opioids that are distributed. And so what it does is, hold on, I'm gonna go over here.
So it destroys the hemoglobin, so that the blood cannot carry oxygen back. It's used in like polyurethane foam and rubber and explosives.
I just addressed the adolescent, treatment services. So there are only 3 in the state of Maryland. None of them are inpatient. And of those 3, only 1 takes Medicaid. So this is definitely a priority. And with the opioid restitution fund that the doctor referred to earlier, the Secretary of Health makes recommendations to the local jurisdictions who are receiving money. And her #1 recommendation was adolescent treatment services. So it's coming. It's definitely a priority. And I couldn't agree more about peers in schools. I think they should be in every school. And you're right, fair, and that kind of stuff. It didn't work. Our kids know what's going on, so I couldn't agree more. That was all that signed up to speak, but I know the rest of you guys have something to say. So Cassie will bring in the microphone if you guys think.
My name's Kate, and I'm a care coordinator of this pre-trial program. And I'm one of those kind of people who will call all over the state to get someone to do the treatment program at any time. The thing I see is programs like Recovery Centers of America. They do great work. My client can't go there. Because I don't have high class clients who have fancy insurance. They're all on Medicaid. That's a hindrance to us. For all we get, it's like great, we have all these treatment programs, but if they don't take Medicaid, they're useless to my client. The other thing that I really come to mind is providing other health services, not just the mental health services, but like dental, especially dental. I know from my experience how bad it can get if you get a toothache from drug use and alcohol use. I ended up in a hospital for 6 days with sepsis and having a doctor tell me, hopefully the antibiotics will work. And that's just from a toothache. It's amazing to know that how much damage that can be done from a tooth. You would think nothing of it, and I know where I have clients coming in who have like jagged teeth and they're broken. They're going to need dental help. Because it's like if they can't get proper dental care, some of them may go back to using because they think I'm going to die anyway. That's all I'm asking you.
Thank you.
Thank you for the work. I'll address your dental piece just because I think that is really making sure that we have dental services that is available for people without health insurance, with Medicaid, with all different kinds of health insurance. Even if you have private health insurance, or even if you have some kind of health insurance, a lot of times people can't afford the co-pays, or the premiums, or whatever comes with it. It's very pricey. What we also need to think about is it's not just preventive routine dental care, it's that emergency care. It's it's even the functional, like if you have a tooth extracted, that's all they can do. well, now you've got a gap in your mouth, and it affects your heat, your self-esteem, and your ability to work with these. So, there are some things that we're doing to try to at least alleviate some of that, right? I mean, we have an emergency dental program through the health department that up until a certain amount, we only have a certain amount of dollars that we get every year for it. But, and we'll get through those dollars for sure. People are in an emergency situation, and they qualify for the program, they can call the health department. We are also very lucky in Southern Maryland to have Southern Maryland Mission of Mercy. And so you may have heard of that through your work, or others may have heard of that. And that's where some of our private dental providers have been incredibly generous and have come together, and typically on an annual basis, if not more, they'll host a clinic. Well, they'll provide free dental care, community members. But that's not all the time, right? I mean, those are like single events, and so we definitely know there's a lot of gaps when it comes to oral health and dental treatment services in the community, and that's definitely on our radar to. Fortunately, the state's made some advances as well by opening up some of the insurance.
Robert, I work for Beacon of Hope. I have a question about the senior citizens around St. Mary's County. I think, well, I've had some senior citizens come in and with the mind made up to go to the patient, but they felt some kind of way or some embarrassment or whatever, where they didn't want to go in around the younger crowd. And I was just thinking we needed a spot for people 55 to 60 and up, you know, where they feel comfortable around their own age, but that could be discouraging to them, you know, from the way they carry themselves.
I agree with you. And if you look at Maryland's last 12 months age group for overdose deaths, every age group except for one is either stayed the same or decreased slightly, and the one that has increased is 55 and older. And the disparity between Black Marylanders and white Marylanders, 55 and older, is even higher than that. So we as a state need to look at why is that, and you bring up a good point, is it because they're not comfortable going to treatment around younger folks? But 55 and older are the highest increasing overdose death rate in the state of Maryland.
I'm Laura, and I work with Rob, and I just want to piggyback on something that Rob said. I think with some of the folks that Mr. Rob is speaking about, they also don't feel comfortable going too far away from home. Those who are seniors really struggle when, you know, we can find them a bed and it's in Annapolis or it's in Baltimore, and sure enough, they're home pretty quick, even if they've found the first to try it. They aren't able to stay. It's just not comfortable. I agree with what Mr. Rob was saying. I wanted to mention, because we are very privileged to hold the award with our company, Pure Healthcare, for the Recovery Community Center and the Adolescent Clubhouse, and work closely with the folks who are justice involved. Thanks to the health department for those things that we're able to do. But one of the things we've really learned over the years is how important recovery capital and helping people with the circularity of issues that they may be encountering between, you know, getting clean and sober, going to treatment perhaps, and then coming out, and then the rest of life is happening. And so we have spent much time and resources on helping people with housing security, food security, ID, insurance, vision check, licenses, all kinds of things, related to basic needs, vocational needs. Transportation is huge. We spend a lot of time helping with that. And it's very much something where it's complex enough that people really need a peer or some care coordination. I heard both of those things as goals. So I applaud the state in thinking about those things, and we appreciate what we've been already able to do and look forward to doing more in the county with those needs. And Serial, I heard you say you want to talk to young people, so you'll be receiving an invitation to come talk to kids at the clubhouse shortly.
Thank you. Thank you for what you said, Phil.
So, I'll speak on just kind of piggybacking what Kate was discussing with the accessibility to treatment centers and care. So being in a for-profit organization, Pyramid Healthcare, who serve predominantly the Medicaid population. So there's a lot of barriers to not being nonprofit and serving a Medicaid population with the Medicaid rates. And I've not shared this with you before, just our concerns with I know there's a rate increase in January. However, we have such low rates in the state of Maryland that, and I'll give the example, we recently received the ability to bill Virginia Medicaid. We can only bill at 75% and it's still more than what we receive for Maryland Medicaid. That's just an example. And I am advocating for that because my staff that are entry level to some mid-level positions are struggling financially. And, we would love to offer, the same quality of care as a Recovery Centers of America, right? However, just based off the rates alone, it does pose some challenges and disadvantages being a for-profit because you can't run fundraisers and advocate and raise funds to compensate for the gaps of finances. So those are some of my concerns, just looking at the operations end and how we can better serve our community. Because if our staff is healthy and they're facing the same detrimental health as the people we're serving. And a lot of our clients or staff coming in, they are persons with lived experience. And it's challenging because sometimes those same detriments to health leads to some of them going back into using substances because they do not have that housing, they can't afford housing. We have a lot of resources here in St. Mary's County in the Southern Maryland region that like, hey, reach out for, energy assistance or, we could do what we can to give them the same access to the resources as we provide our clients. But it's challenging and it's discouraging for some people to come to work day to day. And they're simply driven by their passion to serve this community. Thank you.
I agree.
I know, I didn't really talk about it, but I just thought
No, I
for
appreciate
this,
it.
it's important.
It is. And like peers in general and even lower level positions that aren't peers and medium positions, like we're asking people to put themselves in an environment that almost costs them everything in a lot of circumstances. And to not be able to provide, a home or keep the lights on it, it's not fair.
Yeah, it's very challenging.
You guys are going easy on me today. All right. Well, you look like you want to.
I know.
Yeah.
Gary. Certified peer recovery. Never really been to the town, so kind of new to this, but I would say that they need guys like myself in the peer support to reach back out to the community. The local urban communities stated, first of all, I want to say your story was very inspiring. I think you came because a friend, right?
because of results. Like, sorry to hear that. But in my community, I see that, hear that often, you know, and, we don't hear about, these type of hall meetings where people come out and be a voice and advocate. You know, I wouldn't have known nothing about this if it wasn't for, Zeno. And I built a relationship, but, you know, we need guys that, like myself, that would be some type of liaison to the community. To the community that don't know, guys is out there to say what's up, ones that's dying because of the results of drugs, alcohol, and the substance abuse and the trauma from the childhood experiences and stuff like that inside the school system and stuff. And I'm just learning about being an advocate for those who can't speak for themselves. But if they out there and they addicted, right, and they use it, their families kind of don't know how to deal with that, right? Most families don't know how to deal with it. Our family say you strong enough, you can beat it, right? But it's a disease. You know what I'm saying? It don't work like that. You know, for me, I suffered alcohol, right? And I wasn't strong enough. You know what I mean? So I had to go through the system and then liaison in the court system because I had to advocate for myself, get treatment inside the court. They wanted just to prosecute. You know, I'm like, hey, like this is I never asked you guys for treatment. Allow me to go to treatment. Judge took a chance to allow me to go to treatment. Now I'm certified, you know, peer support, recovery coach, you know, harm reduction. So I understand about harm reduction. A lot of people don't know about harm reduction, what harm reduction is. So they put a stigma on that, right? And say you're a junkie or you're a crackhead or you're a drunk or, you know, those type of things that kick people down that's already in the hole. So, you know, you need guys like myself that know, that been through it, that lived through it, experienced it, know the court system, know the pretrial system, know, you know, those type of system and know the resources that's out here. But I wouldn't have known. I don't know these resources that you pulled up on. And I lived in St. Mary's my whole life. I went to school, downtown high school there, you know what I mean, graduated, played on basketball team. So you need guys like myself to go out there to advocate what you guys are offering, right, to the community. You know, and that spreads, you know, because the best resources is word of mouth. It ain't Facebook, it ain't social media, it's word of mouth. It travels fast more than anything. And it needs somebody like myself that's been through that. So when I, you know, go back into the community and say, I went to the town hall meeting, this is what these guys are doing. That's how the word spreads. That's how it changes lives. So, see that you said that y'all was trying to do resources. Yeah.
So all of you guys are putting in the work now.
You just said it so beautifully, and I just really appreciate you sharing. There's nothing that gives more hope than seeing somebody who's and I wholeheartedly agree with you, and we're just so fortunate for Dee and others on our team at the health department to have just done amazing work getting back to this. And really, that's something we want to continue to build, is how do we better engage people who have experience and use that experience to build trust and to advocate and to help people, you know, raise their voice, right, when they need to be heard. And so anything we can do at the health department, I know many of our partners are very interested in this too. And so anything we can do to better connect with our community and to really leverage people who are trusted already. What the hub services I was talking about, we just started that in January. It's not even been a full year. You're right, down here in St. Mary's County especially, it is word of mouth. And we hope that over time, as word of mouth gets around, and as people like you help to get these resources connected to our community members, that we'll start to see more and more of our community members use the services.
I'm just saying, you know, that's what we do at the Beacon. I hope we on smart, well, we associate smart meetings, codependency and a whole bunch of other groups, grief and, you know, anonymous. We facilitate a whole bunch of groups in that community center to try to help folks out here that need help. And that's what we're there for. We have our doors open for them. We welcome them when they come to the Beacon House to try to help them and assist them with recovery coaching and all of that. We work with the people that come in off the streets. We try to refer them to the right places and give them ideas on how to get back in the community to live or know harm or better. That's what the Beacon of Hope does. That's what the Beacon does.
Thank you.
Is there anyone else?
Very much.
And I've been begging of the market meetings for a town hall down here, down south, because I hear about them all up north, so I'm so grateful you're down here. So I'm wondering, speaking from going out in the community, the outreach, is there a specific outreach branch of the health department that deals with educating and awareness and advocating? And if so, are they open to anyone coming in and saying, I want to be a part of, because I lived it, I walked it, I talked it.
So I think you can probably speak more from a local level, from a state level, we're always looking for outreach partners, and that's something that's a priority with the ORF money is how do you get into communities more and into the communities that aren't looking on Facebook or, you know, aren't paying attention to government websites, because let's be honest, not a lot of people are, unless you work for government. So yeah, outreach is very, very important to us. I know on a local level, every county kind of does something different. So, Dr. Brewster can speak to what's happening here, but I know like in Washington County, for example, and I just use that because it's my home, where I know like we have a team that meets once a month with the health department. And they focus on, you know, how can they go out, what can they do, how can they, what events are happening in the city and in the county that month that they can be at, that they can walk around at, you know, where are they? We have a homeless coalition, and some of our peer support specialists will go out with the homeless coalition when they do outreach days into different camps and things like that. So it's coordinated differently kind of for every county.
Thank you, and thank you for being here. But yes, the answer is yes, a strong resounding yes. And many of our team members that are here are walking around the neighborhood, people holding, you know, that one-on-one talks. Really, really. We do have a program that allows people to just walk in and they just want to sit, rest for. So yes, there's a variety of ways that we are connecting with community members. A lot of that is on the ground, but there is always a place in the home for volunteers, and we welcome our community members involved. Maybe Lily is our behavioral health director, and she can talk a bit about some of the work that we're doing with prevention things.
So I would also say, we also have our Healthy Safe Marriage Partnership that is open to all of St. Mary's, and we have our Behavioral Health Action Team, as well as our Violence, Injury, and Trauma Coalition that are run by our community members, our co-chairs, our community members, We support that at the health department where we utilize those meetings, as kind of a subgroup to our local behavioral health authority. We also do have prevention and outreach coordination, as well as through our opioid crisis response coordination and harm reduction, that we participate in a variety of events and things like that. Might have to call Vicki, my counterpart in Washington, to ask her about the community meeting. Again, looking at how we can get more of that, because our harm reduction and all of our peers and care coordinators are constantly out in the community, but obviously we're not doing it well enough. And so how can we get better at doing it? How can we also get community members to be a part of that, to making sure that we get the word out? So we're always open for communication, suggestions of how we can do things differently, because just because we've been doing it one way doesn't mean it's the right way. So, you know, you can reach out to myself or any one of our team members that are here, and we'll definitely look at it and try to figure out, you know, how we can do things better. Because our goal is serving St. Mary's and bringing services, bringing awareness, reducing harm to the individuals, and meeting them where they are. That is our philosophy for our entire division. And that's something that we pride ourselves on here in St. Mary's within our division, of using the harm reduction model throughout our entire division, no matter what role we're in, of meeting that person where they are and making sure that everybody is using stigma-friendly language, and not being stigmatized. We're, you know, met with multiple jurisdictions, in Washington County was one of them when we initiated our St. Mary's Go Purple. And we do a lot of collaboration with the Beacon of Hope, the Code, On Our Own of St. Mary's, as well as Maryland Coalition of Families, which are all peer support run programs. And so we're always looking at how we can do things differently. And, you know, you guys are the ones that we need to hear from and how we can do that. So hopefully that was helpful, but I think we're all open to how to make St. Mary's that much better.
Hi, my name is Nicole. I'm a counselor at Pyramid in Charlotte Hall. I've noticed that there's a lot of frustration that comes from clients. There's not transition housing here. Everything's really located in like Hagerstown, Baltimore, Annapolis, Frederick, but there's nothing here. There is Dockside, which is in California. That's only for men, and there's not. I don't think there's anything else out here other than that.
That's been probably the second or third biggest frustration we've heard across the state. Transportation's overwhelmingly number one, but recovery homes, transitional homes, and adolescent services are, you know, second and third. So it is something that we recognize is a major issue and is going to be a focus, especially as the opioid restitution fund money comes in and we're looking at ways to allocate that. Again, we have to be recovery friendly. So we know it's a huge need. And
in regard to recovery houses, it's difficult to get financing, funding, when there's funding for nonprofits, because you have to be a grant writer or pay somebody to grant write or know the buzzword. I mean, it's difficult. And there was just your playbook and you would do. So it's
May I offer a resource? Let me offer a resource for nonprofits. I'm so sorry. The College of Southern Maryland actually have a nonprofit institute where they have individuals that they're there for the community to assist with grant writing, building their business, and ongoing support. So anyone that are having, you know, that would like to open a recovery home, they can most definitely go to the College of Southern Maryland and go to their nonprofit institute to get assistance with that grant writing and the process to do a startup for recovery housing. Thank you.
Hi, I'm Natasha Admin, one of the providers in St. Mary's. We offer the IOP program, actually just started recently, here in St. Mary's County. We did see a need for the service. Actually, we started our agency in Waldorf, and we had a client that actually migrated to St. Mary's County, and that particular client actually overdosed. And in our PRP program, at that point, I thought it was majorly a need for the IOP intensive outpatient program. So we initially did the process with the state, and gratefully they did work quickly in the licensure process because of the need, especially in St. Mary's County. So I was grateful for that. But I guess for myself, the question that I had, and I hear everyone around the room saying, basically residential, not having the beds and not having the places, recovery homes for people to actually go to. What is the time frame? I mean, I know that it's a focus for the state, but how long is the time frame? Like, how long will the state? How long will it take for the state to actually seek the funding and put things in place and put things in motion for our community? Because ultimately, we understand that it's a focus. However, while we're focusing, we're losing lives.
Yeah.
And so that's the main issue that I just have a question. How long is this process take?
We need providers. And I think that it comes down to that. We need providers. We need the people who are going to open up. If the funding's there, the funding's there, but if we don't have providers to run it or people who are willing to open them, I don't know how long it's going to take. And we've been talking about, how do we incentivize people to come to Maryland? Because that's going to be, we know there's a workforce shortage. We know all across the country, it's not just specific to Maryland. So can we incentivize providers to come here? Can we incentivize people to open up treatment facilities or recovery homes, or what does that look like? But right now, when I was on the shore a couple months ago, they were saying like we have resources, but we don't have anyone to actually do it.
Right, you're right. Because I've had clients that said, they're paying out of pocket for some of the services. So instead of using their Medicaid benefit, so it kind of really, it defeats the purpose to have their state insurance if there aren't providers.
Yeah, it's a vicious cycle. But the workforce shortage is serious, and we need to have bodies to be running facilities. And I think that's step one, the most important one.
And it's just, it's also, we may have providers, but then they can't find the resources in St. Mary's to do the work. So we've had, that's been a challenge of finding the place that they can run the operation. And I know we had that
Yes,
discussion.
we did. It was hard. It's hard to find a location.
Hard to find the location. So oftentimes we do have money and we have to give it back to the state because we can't, we have providers that are interested but can't get off the ground because of locations and areas of things like that. So that is a challenge, and I think that's a challenge across the state, not just in St. Mary's, but it's, that is a part of it. And I think that's where the boots of the ground of reducing stigma and getting words out, can be beneficial.
Rebecca, certified peer recovery specialist, and I'm also the lead peer recovery specialist for St. Mary's County temporarily. What is, I guess, the goal for the lead program as far as working with like the law enforcement, because there is it's so stigmatized with them. In Seattle, it's working amazingly out there, but I mean, is there any type of a goal that you all are seeing or have set this to, destigmatize it with the sheriff's office. It's like the state police, it's not something that we're using with them. It's only our local police department, the sheriff's office. So why isn't the state police, so that is a struggle. And then one other thing is, beds for pregnant women. That is huge, for us, especially down here.
You can't find the police. We have to be that 3.1, and we have to provide your location.
So the law enforcement situation, I'm kind of gonna put on like my previous roles hat, because we had a police department and they were, very open to leave. They were open to leave because it took the other officers who believed in the program and who saw it working, advocating to their fellow officers.
Yes.
And when we found those specific officers who truly believed in diversion, who truly saw like the positive outcomes, then they were able to get the fellow officers on board. I can stand in front of law enforcement all day and hope that some of them hear me, right? But just like peers advocate more for peers, it's the same with law enforcement. So my office, a good operational command center, we partner with HIDA, and we have, her name is Sabrina. She's a partner. She works 50% of the time with us, 50% of the time with HIDA, which is high intensity drug trafficking agency. They are a police force for Baltimore, Washington County. So she works with an officer. She's a public health analyst, and their job is to coordinate between police departments, police officers, and public health. They're very successful at it. They're actually going on like a state tour right now to kind of meet with the local PDs. That provides great perspective. So you have a public health specialist and you have someone with a lot of law enforcement experience. So they can work together. The officer can talk officer, public health person can speak public health, and then get that buy-in. But I mean, that's a culture that is tough to change because it's the way they've always done it, right? So now we're asking them, hey, we want you to change course, and you grow up thinking you're going to be a police officer and you're going to make arrests and you're going to do these things. So I'm like not faulting them by any means. It's a long-standing what they've always done. So we're asking them to switch gears. It's going to take a while to get used to a new mindset. I will say we have a really good police departments all across Maryland that are buying in, but I do really think it takes officers getting the other officers to buy in and working with the health departments and seeing the successes, because that's what we saw in Washington County. Once officers started saying like, oh, I've arrested you 10 times and now you just showed me your 90-day point, and they were like proud of that, like we helped that happen. And so I think that mindset is a really positive thing, but it's not going to happen overnight. We're getting there, and we will get there.
I just wanted to mention a tidbit of the struggle that we have at harm reduction with like chain businesses and gas stations and grocery stores and things like that. At an executive level, they don't want Narcan there. The staff wants Narcan, but at an executive level, they just won't allow it. So if you can do anything from a state level for that, that would be really good. I mean, what times do we hear of an overdose at a gas station? Well, yeah, all over the place.
That's really confusing to me, because you would think, from a business standpoint, that they would want to be helping people stay blessed.
Yeah. Even Walmart, like places like Walmart
And hotels, because we've had them hand us the Narcan back, saying that they can no longer keep it.
because of like executive level.
Yeah.
Yeah.
I'll get them. Is there anyone else who would like to?
I just have a idea. It's not really mine. It's just something I've seen in other counties. in regards to spacing or recovery housing, treatment, facilities. In some places, there's, some counties that offer vacant county buildings to utilize for recovery housing or treatment centers. Could, I guess, we ask some of our jurisdictions in our counties to say, hey, these vacant county buildings could be used for possible treatment centers. Because if they've been vacant for years and some of them decades, we can utilize it for a really good purpose. So when there are interests that are there for recovery housing for women or 3.1 housing, you know, we can really put that to good use. So I don't know if that's something we could just ask of our county officials.
So here's the very frustrating part with that. That's a great idea if the county or the municipality actually owns the building. If they actually own the building, then yes, they could sell it for $1.
Yes.
The problem is when you drive around Maryland, in a lot of jurisdictions, the vacant houses that you see that are falling down, that have been vacant for 20 years, they're owned by somebody, but it's not the city or county. And then they have no jurisdiction over that. If that person is paying their taxes, even if someone hasn't lived there in 20 years, they own that property. So that's the very frustrating part, because you see wonderful buildings all around. You're like, my goodness, I could do so much with this, but there's someone that owns it and it's not the city, county, or state. Now, there are circumstances in municipalities and counties that have buildings, but like in Washington County, for example, it's very rare. There are beautiful, huge buildings that could be put to so much good use, but they don't own them. So they can't do anything about it. If the taxes are current and they can't take it to tax sale, then that's that. So if you find a building that is owned by a county or municipality, they absolutely can do that.
Yeah. Is there a list?
Just an idea.
Yeah, no,
Question.
it is, it's a great idea. And it was very frustrating as an elected official, because we have these buildings that are like, we could do so much with this, but you know, you own it, or you own it, or you own it, and that's that. So
We have a lot of contractor buildings that are now vacant.
So, a lot of buildings because of COVID, businesses went out. Problem with having an older building is most people will tell you that if it's an old building, it's best to tear it down because it's gonna cost you so much to bring it back to code. The paint, the insulate, you know, all the, toxic stuff. Electrical, plumbing, you might as well just raise it and start up, but at least the property, you know.
well, thank you guys again. Thank you to the vendors that came tonight. Thank you guys for being here, and to all you community members. Thank you for what you do every day. Thank you for coming and listening, sharing your thoughts. Dr. Brewster, thank you and your team for all that you do. It's been great being here today. I'll stick around. You can contact my team at any time. Our website is beforeitstoolate.maryland.gov. My email is just my name, emily.keller@maryland.gov. And there's cards out there. I have some cards on me, so feel free to reach out anytime. Really looking forward to working with all of you guys, especially over the next year, as we really start to like bear down and come up with a new plan. Since after January, we will be done all 24 town halls, and we're going to get work. We're already starting stakeholder interviews, like internal with the state, and going to be meeting with local organizations, get all their feedback, and ready to continue hitting the ground running. So thanks again for your time. Look forward to working with you guys.
Thank you.